contrast and compare Hep C and HIV. They're both viruses. They're both RNA viruses, although HIV has a wrinkle. It goes through a DNA phase, whereas Hep C does not. And that's important because you and I are made up of DNA. And a DNA virus can become part of us, which makes it almost impossible to cure. So HIV and Hep B fall into that category. Whereas Hep C never goes into a DNA phase, so it's potentially curable. So all of our outcomes when we try and treat Hep C are to try and cure Hep C, which is possible. You know how HIV is spread? It's sexually and through blood. And absolutely, can you get Hep C that way? The answer is yes, but it's not quite as easy to pass it sexually, but it does happen. Okay. Whereas by blood, it's much more easy to get Hep C through blood than HIV, for example. And more than that, Hep C is a more hardy character than HIV. So if you took, for example, something that has blood on it and you let it dry, so it's needles or syringes, it dries for 15, 30 minutes, HIV is pretty much dead. But Hep C is still alive for a whole day, 24 hours. Okay, so some of the harm reduction stuff, if you just rely on drying it out, will not work for hepatitis C.
What about sharing a cigarette with saliva?
It has to be blood. So saliva is not very infectious. So even sexually, we don't know exactly. It's just imagine how if you wanted to study sexual transmission, what kinds of questions would you ask? And the people who are studying it are not the best. We don't know exactly how people pass it on sexually, but it's thought that there's some component of bleeding involved. So saliva, you shouldn't. Okay, it's bleeding, and then you break another surface. HIV obviously attacks your immune system, specifically the CD4 positive T cells. That's why people with HIV are always monitoring your T count or your CD4 count. Whereas with hepatitis, it infects the liver cells. That's primarily where the damage is done. Now, it should be of what kind of symptoms do you get? Well, in people with new HIV infection, they can almost feel like they have mono. They don't know what's going on. They just feel that they feel unwell. And the same thing is true for hepatitis C. People think that hepatitis you get jaundice, but the vast majority of people with hep C do not get jaundice. And in fact, the most common symptom of hepatitis is nothing. Okay? So, and exactly the same thing with HIV. A lot of people have HIV and don't know it, and they don't know it until their CD4s fall so low they get something like PCP pneumonia, so they get an AIDS-defining illness. The symptom of hep C infection is actually liver failure. Okay, so not only do you have hepatitis for a long, long time, but you develop cirrhosis, and long after you develop cirrhosis, you get liver failure, and those are the symptoms of hepatitis C. You get tired, your muscles waste away, you get jaundice, and you get ascites. So hopefully we want to prevent that from ever happening. So this is the push, is to find people with hepatitis C and treat it before you ever get to that stage. Okay, so given that hepatitis C affects the liver, do you know what the liver does? I used to ask this routinely and nobody ever got it right because people would always say it's a filter, it gets rid of your toxins, which is exactly the wrong answer. Okay, your kidneys are your body's filter, and you filter the bad stuff out as your urine. Okay. So where does the liver fit into this? So it's part of the digestive tract. So when you're eating, you're chewing, food goes into your stomach, all the good stuff gets broken down into small molecules. And what do you do with it next? Well, you absorb it, and the first place it goes to is actually your liver. So all raw materials from food go to your liver. Your liver is a factory. It will take raw materials and build things out of it. So instead of building a car, you're building fats, carbohydrates, and proteins. Most proteins in your body is actually made in your liver. So your liver is a very essential organ. Okay? So whenever you make something, you're never 100% efficient. You will always make some stuff that you don't need, some waste material. So your liver also has to get rid of things that you don't want. Okay, and whenever you absorb stuff, your gut's not completely sterile. You will also absorb some bacteria. Your liver also has to be able to deal with whatever infectious particles you absorb. So that's what the liver does. It's actually a factory. Okay, so if that's what the liver does, what happens when you have hepatitis C leading on to cirrhosis and liver failure? So the very first thing is, even when you have no symptoms, is the liver becomes completely scarred up. So this is the liver right here. Okay, so when you eat, the food is coming down into your stomach, the food comes down to here, you see all these veins, they drain the blood of nutrients going to the liver. All right, so if the liver is completely scarred, the blood can't flow through the liver properly. That's cirrhosis. So the veins leading to the liver are like little sausage-shaped balloons. Okay, the pressure will actually blow it up. So if you look on the lining of the stomach and the esophagus, these veins are on the surface, almost like varicose veins. They can get very, very big and distend, and these veins can burst like any balloon. And if that happens, that's what we call variceal bleeding. Way before that happens, this is the spleen over here. Does anyone know what the spleen does? No. It's an immune surveillance organ as well. But the thing about the spleen is that blood comes in, filters through the spleen looking for infectious particles, and it has to go back out. But because of the buildup of pressure here, the blood can't leave the spleen very quickly. The spleen is also like a balloon. It too will build up, and the spleen will get big. And the very first sign of cirrhosis is actually on a routine blood test. You will see that your cell counts are starting to fall, mainly the platelet count. So if someone has hepatitis C and the platelets are low, it's a good chance, 90% chance they already have cirrhosis, even though they feel perfectly fine. No symptoms, okay? The next stage of cirrhosis is when they have liver failure. So when the liver cannot do its job as a factory to make proteins and carbohydrates. And there are two main things that we can measure. One is clotting factors, okay, and that's reflected by a blood test called the INR. If your clotting factors fall to about 10% of normal or lower, your INR starts to go up. Okay, so the first blood test sign of liver failure is the INR going up. That has no symptoms. It's a clotting factor. INR is high. You will not bleed to excess when your INR is going up. Okay? The first symptom of liver failure is when your protein levels go down, something called the albumin, which is a big protein in your body. When the albumin goes down, you will notice that your muscle mass starts to disappear. So the face gets skinnier. You see your ribs, so your skin and bones, literally, you start to swell. Your ankles are swelling with water, and your stomach can swell with water, and that's called ascites. And the very, very last stage of cirrhosis, very end stage, is when you can't even throw away waste products, and that's when you turn yellow with jaundice. Okay? So that's liver failure. So how often do you get cirrhosis and how often do you get liver failure? Well, it takes time. Okay, so you don't get hepatitis C infection and all of a sudden get this. It takes many, many years. Can you get cirrhosis within 5 years? Yeah, I've seen it happen once or twice, so it's very, very rare. Can it happen within 5 to 10 years? Same thing, once or twice. Very, very rare. In general, in someone without HIV, it takes a good 20, 30 years. And it's thought that HIV accelerates that. So maybe 20 years people will get to cirrhosis. But it's also true that some people, their liver seems to handle it. Just like HIV, you have these long-term non-progressors or elite controllers. A lot of people with hepatitis C also fit into that category, and their liver disease is actually fine. So yes, they have hepatitis C, but their liver is handling it very well. So who are the people who are at particular risk of having severe liver disease with HIV? What's what you would expect. So if you drink too much alcohol, so how much is too much? Do you guys know?
More than 2 drinks a day.
More than, that's a good guess. That's the average, but not quite right. So it's different for men versus women. So for men, it's more than 3 drinks a day, 5 days out of the week. So in total, 15 standard drinks a day. But then you need to know what a standard drink is. A standard drink is 1.5 ounces of liquor. So a martini down the road is 2 drinks. It's 3 ounces, right? It's a small goblet of wine, not a big one, not a refillable one. And then it's a bottle of beer, not a pint. So those are all 1 standard drinks. So for a typical man who's of typical weight, it's 15 of those in a week, and for a woman, it's 10. Okay? So if you're heavier than that, then the scarring happens much quicker if you have hepatitis C as well. The other one that's probably more common is if you have fat in the liver for other reasons. So alcohol causes fat in the liver, but so does diabetes. So does high cholesterol levels. So does being centrally overweight. So if your weight is mostly in the middle, those people can have fat in the liver, and that too damages your liver quicker than with just hepatitis C. So those are the bad things. What are the good things? So believe it or not, I tell this and people go, what? Coffee. Coffee seems to slow down liver injury, slows down the risk to liver failure, and also reduces the risk of liver cancer. So it's good for the liver, and people are now starting to say it's good for a lot of other stuff. But I just think it's a great social drink. So people ask me, should I take milk thistle? Should I take this herb? I look at them and say, you know what? Coffee is an herb. It's more social and it's cheaper. So I'd go with coffee. Okay, so that's what hepatitis C does, but who gets hepatitis C? So blood products in the past used to be a high risk for hepatitis C. So for example, if you had a blood transfusion in downtown Toronto in the early 1980s, each unit of blood that you received was associated with a 1 in 4 chance, 25% chance of getting hep C, which is why it's not surprising that most hemophiliacs who got factors back then have hepatitis C. Okay? But that's not true since 1991. In Ontario, we've been screening the blood for hepatitis C, so you really should not be getting hep C through a blood product transfusion. But that's not true if you travel and get a blood transfusion from a different part of the world where they may not be doing this. So the last time I saw this was about 10 years ago. Someone was in Cuba for a holiday and riding a moped and got into an accident, got a blood transfusion, and got acute hep C. Okay. The other common place we still see it, unfortunately, is people on dialysis. They go on vacation, they get dialysis at the other countries. So India, Pakistan, dialysis, we see people coming back with hep C. I mentioned that on dry blood surfaces, hep C can survive for 24 hours. So we tell people not to share anything that might have blood on it that can then break your skin. So it's not just needles and syringes, but it's toothbrushes, razor blades, that kind of stuff. Okay. A quick word about sexual transmission, because we are seeing it more and more commonly in those with HIV infection. Okay. So we know that people tend to serosort. So if people think, well, if they have HIV and I have HIV, then we don't need to do safe sex. But don't forget that HIV is not the only infection. So in the setting where two people are HIV positive having sex and one has hep C, it is possible to give hep C to the other person. Exactly what is the sexual practice that does it? We don't know. We think we know. We think it's associated with toys. That's toys. Okay? But not that toy. And we don't know for sure because there are other factors, because men also have increased risk of anal warts or papillomaviruses. There could be more bleeding. So we are seeing more people get it sexually, but who swear that they didn't do anything unusual. But it was unprotected sex. So if you're serosorting and there's discordance in the hep C status, then the companion to the toy is obviously still this. Okay, so the condom will still prevent the transmission of hep C. Finally, probably in Toronto, we have to remember that we get a lot of people from different countries, and a lot of other countries have a lot more hep C than we do. Like even the Americans have a lot more hep C than we do. Okay, so bear that in mind. All right, so I've told you about hep C. It's a problem, potentially, and there's been treatment available for hep C, believe it or not, since 1990. That's when I was starting to treat people with hep C. The problem is that the treatments were really, really bad. They had a lot of side effects, but not only were there side effects, but the treatment did not work. There was an unacceptably high fail rate for treatment. How bad was it? Like the early treatments, now that we look back with a critical eye, were curing 6% of people. So you put them through misery for a year, and 6 out of 100 people got cured. As time went on, we started adding pills to it. But this is like HIV in the late 1990s. Okay, they added a lot, not one pill, but a lot of pills. So when ribavirin first came out, they were adding 6 pills. But then when they added the first generation protease inhibitors, they were almost adding an additional 12 pills. Tons of side effects. Okay, and still the cure rates were better, but not great. So the cure rates were getting up to 70%, 75%, and people were saying, well, that's a huge increase from where we came from. But it's still a lot of suffering for a chance that the treatment will actually fail. Okay? So we've been in this limbo state, and that limbo state is now, I think, over, or it's starting to be over because of the new medications. Last year, all these articles came out in the New England Journal of Medicine, which is a very, very high-powered, high-impact journal, describing all these new medications that are out. And the new medications are a huge leveling field, especially in people with HIV. Because until these medications came out, it was always true that if the treatment responses in people without HIV were bad, they were actually much worse in people with HIV. Okay, and that's because the medications that we were using, which is interferon, not only had side effects, but it actually depended on your own immune system to kick out the hep C virus. Whereas all the new stuff, it doesn't matter what your immune system is doing, the new stuff attacks the virus directly. Okay, so what should be our expectations currently? Our expectations should be that we don't use interferon. Okay, for the most part, we are not using interferon anymore, and that means that the side effects of treatment are gone, so that entire pamphlet side effect is all interferon, it's all wrong. Okay, we don't use it anymore. That without using interferon, the effectiveness of our medications are at least as good as in people without HIV. And actually, that's turning out to be not true. Believe it or not, the treatment success rate in people with HIV is looking like it's better than people without HIV. Okay? Because the most important thing about these new medications is to remember to take your medications every day on time. Adherence. People with HIV who are under control know adherence. People without HIV on no medications do not know adherence. Okay? We expect now that the treatment duration for a cure of this infection to be 12 weeks or less. Okay? Not like HIV forever therapy. We're talking about 3 months of therapy, and the cure rates are over 90%. The side effects, if any, will be low, and there will not be a lot of pills to take. So instead of 18 pills a day, we're talking about 1 pill, maybe 2 pills. That's it. So what are the challenges? Clearly, they're expensive. So that's the main challenge. How are you going to afford these medications? And right now, the way we've done it is some of my patients have had a drug plan who's paid for it. A few of them have paid cash, very few, but they've done it. The drug companies have been generous in my patients who are sick. Okay, both Gilead and AbbVie have been generous in different ways. So if you have liver failure, Gilead has said, we'll give you our drugs. But if you don't have your liver failure, forget it. Whereas AbbVie actually took the other space, which is if your liver cirrhosis is so bad, you're like 1 step away from liver failure, we'll give you treatment. So between the two of them, I've covered the people who are either in liver failure or about to go into liver failure. What I don't have yet are the people who have cirrhosis who are still not that bad. Okay? And for that, I think the province will probably step up to the plate very soon, and we can treat them as well. The other major challenge to these medications, I'd already told you, is adherence. These drugs are less forgiving than HIV. Yes, people with HIV are very good at taking their drugs. They're not perfect, and they miss a dose now and then. And the drugs, I think, have been designed to be that forgiving. They don't tell you that, but a couple of doses now and then is okay. But it may not be true for the Hep C stuff. The Hep C stuff is only 12 weeks, but you have to take your pills, or else you risk treatment failure. Okay, and with treatment failure, you also risk getting resistance such that future treatments may be more difficult. Now, everything I've just told you is true for hepatitis C genotype 1. There are many different genotypes. There's 6 of them. 4 of them are common in this province. Okay, genotype 1 takes care of almost 80% of all of Hep C. The other 20% are genotype 2 and 3. And genotype 3 right now is not so easy to treat, but there are probably new drugs coming next year that will treat them. Okay. Having said that, interferon, ribavirin, the old stuff with tons of side effects, it actually works really well in genotype 2 and 3. So if you're desperate, we actually could treat you. Our cure rates are very, very high. Okay. In present day today, it's probably true to say that I have something that can treat all of these genotypes of Hep C where the expected cure rate is over 90%, which is a huge step forward. Okay. Let me give you a typical case. 48-year-old man referred for Hep C because the antibody is positive. So if you go and see your doctor and say, do I have Hep C, they do a screening test, which is the antibody. The trick with the antibody test is to realize is that it does not mean you have infection. It means you likely have infection. That's what a screening test means. It needs to be confirmed by a viral load or a PCR. If the viral load is negative, you don't have Hep C. And you should never do the antibody test again because you're just someone who happens to have a reactive antibody test, but it means nothing. Okay, so the PCR test is what is required to see if you have infection or not. And once the PCR is positive, then you need to know not just the viral load, but what is the genotype, because the genotype determines how you treat the hepatitis C. The next step is to assess how urgently do you need treatment. And you can't tell. Okay, if you have no symptoms whatsoever, you could have a completely normal liver. So I was in clinic today. I saw a bunch of people like that. But I also saw this young guy who feels fine, doesn't know why he's there. He's got cirrhosis. He didn't know, but the blood test today was very clear. This guy's got cirrhosis. So he needs urgent treatment, okay? And the other factors to consider is how do they get infection? And are they at risk of reinfecting? Because the problem with these things is that there's no vaccine for Hep C. And yes, it can cure your Hep C, but you can get reinfected. There's no such thing as Hep C immunity. If how urgently is treatment needed? Obviously, if there's liver failure or cirrhosis, then you need treatment. So the guy I was telling you about today, he didn't have liver failure, which is why he's got no symptoms, but his platelets were 100. So in that setting, it's cirrhosis until proven otherwise. Not only that, the ALT, AST, I didn't tell you about that. Those are markers of how quickly the liver is being injured. And his ALT was 250. Very unusual for Hep C. Usually it's like 50, 60, 70. So at 200, it means that his liver is being beaten up really, really quickly, and he already has cirrhosis. Finally, if you have a non-liver complication of hepatitis C, then you also should treat the hepatitis C. So for example, certain cancers like B-cell lymphoma are linked to hepatitis C, and treating the hep C will actually help your lymphoma care. Okay, lymphoma may actually go away, or if you need chemotherapy, it might prevent the lymphoma from coming back. There's also something called vasculitis, which is an inflammation of the blood vessels associated with Hep C. It's pretty rare, like 1 to 2% of people with Hep C have it, but it can be very debilitating. It causes discoloration in your legs, and almost people say it's poor circulation, but then it causes ulcers that are non-healing that are very painful. So ulcers can be like huge. Okay. Finally, will the treatment be taken? So it's very good that as doctors I can prescribe the medications, but will you actually take the medications? So that assessment goes on all the time. So in the people who are sick who come to clinic, it's a slam dunk. They say, are you kidding? Of course I'll take the medication. Just get it to me. But I have a lot of other people who barely make it to clinic and who barely take their meds. And I can't watch them take 12 weeks of medications. It's 84 pills over 84 days. So there has to be some sort of commitment. And obviously, it makes a difference if they are socially stable. Do they have housing? Right? Do they have a fridge? Are they still using drugs to the point that they have no control of their life? Same thing with alcohol. And once again, what's the risk of reinfection if I cure them? Is it better to leave someone with chronic Hep C untreated? Or is it better to treat their Hep C, have them get infected over and over and over and over again? All right? In the past, we never had the medications to treat people over and over and over and over again. But I did have one person where we did that. But each time he got infected, his liver got damaged a lot. So it was almost worse that we treated him than if we had left him alone. Okay? So based on all of that, when you see someone, you say, do I treat you now or do I wait? Most of the time, I must admit, we are waiting because they can't afford the medications. Okay? It's actually very unlikely in this day and age where they're very sick and I cannot get them medications because of those three. Either they have a private drug plan, they have cash, or the drug companies have been pretty generous and will give us medications when we need it for sick people. Future prospects, believe it or not, even though these drugs are great, there are actually more drugs coming out. So Gilead has their 1 pill a day Harvoni, but they actually have other stuff in the pipeline. AbbVie has their 2-pill Hokira pack. They too have drugs in the pipeline. Other players, Merck, you heard as a sponsor, they have drugs in the pipeline. Okay. We do have certain limitations with the drugs right now. So, for example, the new drugs that I told you about don't work well at all for genotype 3. So you have genotype 3 infection. It's a lot of waiting. Do I have a lot of genotype 3 infection, HIV co-infection people waiting? The answer is no, because they were all cured years ago with interferon ribavirin, because that one responds to interferon ribavirin. If you have renal failure along with everything else, then we are still waiting because these drugs have not been great, Hokira has some evidence for renal failure, but Harvoni does not. And if you're on dialysis, we haven't crossed that bridge yet. Okay? And finally, when can we get the medications to most of the people? When is it affordable? When will government pay for it? And hopefully, when will the cost of these medications fall? So in summary, in 2015, time for waiting on Hep C treatment is over. So for the last few years, I've been saying to people, don't get treated now, wait, because new stuff is coming. And all those people were mad at me last year are now very happy that they waited. Okay, there's now a high probability of success, over 90%. I didn't tell you about the side effects. Okay, most people feel no side effects. A few people feel more tired, especially in the first week or two of treatment. But the neat thing with these drugs, which we never could say before, is that some people actually feel better on treatment. Okay, so we have all these people that didn't even knew they felt tired, go on these drugs and say, wow, I feel like I've got energy, which is very encouraging. Access to treatment is the main problem. It's the cost. But those with the greatest need, I think, are being met. And the challenge is the next level of need. So the people who are not imminently sick, but we shouldn't let them get worse to the point where things can happen. And I think that's it.